Hey, what's going on, guys? I just saw this video on filler by Brett Cooper. I am gonna do a little reaction video with my own personal comments. Let me know what you think.
So it stays and causes swelling, which causes pillow face,
unproven.
puffed up cheeks, or Kylie Jenner at the Met Gala, where everybody was saying that she looked like she
These
was
are the
40 years old.
over-injected looks that I was talking about.
And it's wild that there's no standard of conversation or standard of care.
There absolutely is.
The filler has not dissolved, and a lot of people assume that it was
Again,
just because
not true.
This is just such a crap show. Now,
This I actually agree with.
to see if the treatment affects the risks of diseases.
There, that is actually key. So we have found something, and there is more research going in to understand. This is sort of the same question that I get a lot of times on breast implants, where we have a conversation with patients about breast implant illness. A lot of patients ask me, why do you remove implants but also put implants in? And for me, it's because for the vast majority of the population, implants are very, very safe, and there are hundreds of studies. Breast implants are the most studied medical device in human history. However, there are some patients who don't do well with them. It's a foreign body, causes an inflammatory reaction, and a lot of people do well with it, but some people don't. And so I am willing to sit down with patients who want breast implants, talk about the risks, talk about the pros and cons, and if that's something that they want, then we do that procedure. I also am willing to sit down with patients who feel like their implants are causing them problems, and again, talk about the risks and the benefits, the pros and the cons, and take those implants out. Again, telling them I don't know for sure that that will fix the symptoms that they are feeling, but we go through a long, lengthy discussion about all of this. It's hard to put up black and white stops with all of this because everybody's body is so completely unique and completely different.
All right, so the video that started this conversation on TikTok was from a doctor who took one of these MRIs and decided to talk people through it. And they were absolutely floored.
So what you're looking at here is an MRI image of a 33-year-old patient who had over 12 cc, which is 12 syringes of hyaluronic acid filler injected to her face over the past 6 years.
Here's the problem with this video. I want to find more about the MRI and what he's actually targeting on the MRI, saying that he's scanning filler. My suspicion is that he's scanning collagen and not actually filler, because the hyaluronic acid itself, just biologically and chemically, is getting broken down into sugars that your body will just naturally absorb. However, the effects that it's left behind can be permanent. It's stretched the tissue out, it's attracted collagen, it's attracted water to the area, and that can permanently change the structure and the composition of that tissue.
We measured the amount of filler, the amount of volume that was there.
Just some very, very basics about filler. Okay, there are several different types of filler available, some more short-term, some longer lasting, some permanent. The most common type of filler is what's called hyaluronic acid, and hyaluronic acid is essentially a polysaccharide. It's a big, long sugar molecule composed of chains of oligosaccharides like glucosamine, and it gets broken down in your body by a natural enzyme called hyaluronidase. Hyaluronidase is also an enzyme that we can inject if somebody has a problem with their filler, like if it causes vascular occlusion, or if somebody has too much filler and they want to dissolve some of their filler faster than it naturally would.
Hyaluronic acid fillers are hydrophilic. That means they love water, and they also cause tissue expansion.
I had no idea that it actually never went away.
Did he talk about how far out the MRI was from the patient? I don't remember either. Okay, so this big fear going around right now, the filler actually stays forever and expands, is a little bit of a misnomer. So hyaluronic acid is very hydrophilic, which means it attracts collagen and it attracts water to the soft tissue. That's how it works. Over time, you will have tissue that has been expanded naturally by this substance because you're injecting a substance into the tissue and expanding it. Fillers are doing the same type of thing for your lips or your cheeks or your chin or areas of your face that you're wanting to change the contour of. Essentially and ideally, you won't need filler continuously.
I mean, like, what is it with the medical industry that somehow is apparently just, exempt from all regulations, exempt from actually being honest.
When this girl goes off on doctors having no regulations, it takes years and multiple studies for a drug like a filler to get approved by the FDA to be able to use in practice.
And all throughout the comment section, women were saying, well, my esthetician is still telling me that I need to come in every 6 months, come get injected for the 4th time this year.
And this is where things really start to become problematic for this and why some of these fear tactics work, because there are injectors out there and physicians out there who push their patients to come in every 4 to 6 months for new filler. Unfortunately, there are a lot of practitioners who don't have the wherewithal to say, hey, I think we've reached a good endpoint here. And sometimes you have patients who don't have the wherewithal to say, I think I've reached a good endpoint, and I think my lips, my cheeks, my chin, whatever we're filling has reached a good endpoint. And so they continue to inject. And you can see some classic over-injected faces when you see somebody with these kind of prominent over-injected duck lips, cheekbones that are just way too filled, way too plump, and they just don't look quite natural.
That is why I really don't feel bad for Kylie Jenner when she was sitting on the Kardashian show and crying about people making comments about her face. Like, you lied about your cosmetic procedures, made everybody else feel terrible about themselves. They did this. They now regret it. They're angry at you. Now you regret it, and you're not taking any accountability. Like, this is just such a crap show. Now,
This I actually agree with. You should actually own your work that you have done.
Under this umbrella has been pillow face. And if you don't know what that is, think Chrissy Teigen as of recently, big puffed up cheeks, or Kylie Jenner at the Met Gala where everybody was saying that she looked like she was
These are the
12 years old.
over-injected looks that I was talking about.
Balloon. That is pillow face. And that is all because the filler has not dissolved. And a lot of people assume that it was
Again,
just because
not true.
Metabolize over time. It in fact migrates or spreads to other areas of your face and continues to cause tissue expansion. And so the people who make a habit of getting filler regularly, this is kind of what you end up with.
This is why it's so important to have a practitioner, whether it's a nurse practitioner, nurse injector, PA, physician, who can put a boundary up between him or herself and his or her patient, and where a patient can also put up those boundaries. If you feel like you don't need more filler, you should be willing and able to say, hey, you know what, I'm good. And as providers, we need to be able to tell our patients, like, hey, it's enough. And it's also going to continue to be hydrophilic, attract water, and lay down collagen. And this phenomenon is absolutely something we should talk about. I agree with some of the end results here. I don't necessarily agree with it being just filler that has stuck around. It's usually the effects of hyaluronic acid and tissue expansion and hydrophilic molecules that have been injected, not technically the actual filler just sitting there.
I mean, it's just wild. And it's wild that there's no standard of conversation or standard of care.
There absolutely
as all this
is.
information is coming out. Somebody commented and said, I've never been more happy to be too broke for this stuff. Another person said, I lost 2 friends to filler. They didn't pass or anything. I just couldn't look at them any longer. Yeah, that's me with all the pillow face people.
I also get a lot of patients who come in and they have filler that's been injected under the eyes and the tear troughs or in certain areas like the nasolabial folds, and they can feel it. And we've tried injecting a hyaluronidase to dissolve it, and they want it removed. It is extremely difficult to go in and actually remove any filler, whether it was a permanent filler or whether it's the results of too much filler that's been injected. You can dissolve it and improve things, but sometimes that still leaves behind scar tissue. And oftentimes the only way to actually get it out is to cut it out. And by cutting it out, you're leaving a scar in exchange for that palpable filler that's there.
One commenter said, it clogs your lymphatics, then the lymphatics can't drain fluid, so it stays and causes swelling, which causes pillow face.
Unproven.
Here's that original doctor covering that as well.
We wanted to investigate to see if fillers can block the lymphatics, which is your body's natural plumbing system. The answer was yes. What you're looking at is an imaging study that maps the lymphatics using a fluorescent dye. On a typical person without fillers, the fluorescent dye would disappear within 24 hours. However, she still displayed fluorescence for 4 to 5 days, signifying blocked lymphatics.
That is insane. That is intense. These fillers have been in use since 1996.
I agree. Like, that is actually interesting and surprising that the lymphatic system is blocked for that long. However, again, this is where science becomes important. Is that significant? Is it significant that the lymphatics were not drained as quickly for a period of 4 to 5 days? Maybe, but also maybe not. And so this is where you have to design and create randomized controlled studies where you can look at actual outcomes of people with blockage to the lymphatic channels in their face and how that affects their overall health. Difficult studies to design and difficult studies to do. And so instead, we just create these one-off images to scare people rather than give actual evidence and actual data. So I don't disagree with what she's showing, but what is the significance of what she's showing?
And they've been common for over 10 years at this point. And we are just now having this conversation. The studies are just now coming out. Well, actually, all of this started coming out last year, but still it is not common knowledge.
Okay, so let me tell you one of the biggest problems I have with these videos. They're coming from a place of shame, which is the problem. She goes off on this tangent, reaming out the Kardashians for being dishonest about their plastic surgery, all of that, which I understand. The whole idea is, hey, plastic surgery, you should have owned it, should have just been honest about it. But then we go on this whole tangent where we're bringing shame to people who have overinjected, who have this look and this pillow face, and we're attaching shame to overly done patients or even anybody who would dare to get these fillers or have any type of work done. That, I think, is a core problem in plastic surgery today. There is a stigma of shame attached to it. And in my opinion, there's no shame associated in plastic surgery when it's done for the right reasons. It is very important to never tell somebody, hey, gosh, you need plastic surgery. That's obvious. We know that. That's a mean thing to say. It's just as mean, it's just as toxic, and just as shame-based to tell somebody, sorry, you can't have plastic surgery. You have to accept this as it is, no matter what, because that is the right thing to do. I just don't like shame on either side of it.
Last year, a new study was released on this, and the study found that hyaluronic acid has been found to block the lymphatic channels, which help the body drain fluid and are a key part of the immune system that helps to fight disease. Research is now being planned to see if the treatment affects the risks of diseases.
There. That is actually key. So we have found something, and there is more research going in to understand the significance of those findings. Because if they do a bunch of research and they say, hey, you know, it does block it for a few days, but it actually makes no difference, that's interesting.
To see if the treatment affects the risks of diseases, including cancer. And there were so many people, obviously, guys, this is anecdotal. There is no hard evidence of this yet. There were so many people.
Thank you.
Now, many doctors have still just charged ahead with their practices, obviously, because normal people who are getting filler regularly still do not know about this. But some good doctors have already taken a step back. One New York City plastic surgeon immediately halted all filler at his practice, saying that the problem is with the substance itself. No matter how skilled the injector, the substance can still block these lymphatic channels. He immediately stopped providing filler at his practice following the research findings. And he said, I cannot in good conscience provide this to my patients anymore because of what I saw. I have a daughter. She's 16 years old, and I don't want her, when she's 20, putting this stuff in her face. I mean, that is a great doctor. And that is a good father.
I actually don't disagree with this. If findings come out where it is shown to be unsafe, absolutely. You have to have real conversations about risks. You have to have real conversations about pros and cons of all of the surgeries and the procedures that you're performing, whether it's with filler or Botox or full-blown surgery using implants. And again, this is shame-based marketing here, where she's calling out doctors who have done this. These are good doctors and good fathers, as opposed to anybody still providing filler is therefore suddenly lumped in with bad doctors and essentially apparently bad fathers.
That is what doctors should be doing. Young women do not need to be injecting this into their naturally plump and healthy and hydrated faces to try to fit a beauty standard or jump on a trend that they're seeing on TikTok, especially not when the potential side effects are so long-lasting and can be so severe. They are studying to see if this is connected with cancer. There is no reason for you to be doing this.
It's fear-mongering techniques to drive followers, drive views, and promote whatever for something that we really know quite a bit about. That's what's hard, and that's why these videos kind of get under my skin a little bit. There are hundreds of studies looking at the histological studies of these drugs, how they break down, where they break down, how they're safe, the longevity of them. Those exist. Those have been passed. That's why they've been FDA approved. Anyway, that's just some of my initial thoughts.